Hello, it's me again. I know it's been a while since the last time I posted, and I'm sorry about that. I had a whole lot of stuff going on in my normal life. I'm sure you all know how that is. So today, I'm actually going to be talking about... I'm going to be talking about vital signs. I'm going to be talking about normal vital signs versus your vital signs. So, a lot of people don't know what to expect when they go to the doctor in regards to what's normal for them. So, let's go ahead and talk about that for a minute. I'm going to save blood pressure for last because that seems to be the big culprit. A lot of people are concerned about blood pressure. So, let's go through heart rate. Normal heart rate is anywhere between 60 beats per minute and 100 beats per minute. Anything below 60 beats per minute we're concerned about, especially if you're having symptoms. And I've seen some people 55 beats a minute and they're not having any problems, and that's fine. Usually, because it is such a wide range, anything outside of that we're concerned about. Athletes will have a lower resting pulse than, say, someone who's 30 pounds overweight. So that's that. Respiratory rates. Anywhere between 12 breaths per minute to 20 breaths per minute. The same thing applies. Usually athletes will have a lower resting respiratory rate than someone who is stressed out or has some extra weight that they're carrying around. So temperatures. Everyone knows temperature, knows normal temperatures. But there are several different types of temperatures. So you might not know all of them. So our rate for normal oral temperatures is 96.8 to 99.5. I even have to cheat. I can't always remember it. So then there's axillary temperature or armpit. Usually someone's not going to take an axillary temperature unless the patient has an oxygen mask over their face, or for some reason can't open their mouth, or it's a baby. Used to take babies' temperatures rectally. Don't do that anymore. Causes a lot of problems, a lot of distress. So normal axillary temperatures I don't even have written down because you're not going to run into that. If you're sitting here watching this and you understand it, chances are nobody's going to take your armpit temperature. Rectal temperature tends to be higher because it's very warm in that area. So 97.3 to 100.2 is normal for rectal temperature. Tympanic or temporal. If you ever go to the doctor or you go to the hospital and the nurse or the CNA comes in and she runs this weird looking bell thing across your forehead and down the side of your cheek, she's taking your temperature. She's taking your tympanic temperature or your temporal temperature. And that close to rectal is 97.2 to 100. And okay, so those are your basic, pretty cut and dry vital signs. Let's talk about blood pressure though. A lot of people have a hard time with blood pressure. They think that the blood pressure is the end-all be-all of the vital signs to see how you're doing health-wise. So normal range for blood pressure is 90 over 60 on the low end to 120 over 80 on the high end. Now, same thing applies for blood pressure that applies for heart rate. If you are an athlete, you do a lot of cardiovascular, spin class, treadmill, run, dance, anything that requires you to breathe hard while you're working out, you're going to have a lower resting blood pressure. People who have extra weight, have high stress jobs, maybe even genetically have hypertension or high blood pressure, same thing, are going to be higher. So, with high blood pressure, if it gets to be above 120 over 80, your doctor's probably going to start putting you on medications or want to watch you. So if you're below 90/60, which is rare, I've seen people as low as 98/64 or 62. We're concerned, probably going to keep an eye on you. See if you're going to have any symptoms, fainting, dizziness, blacking out, things like that. Okay, so let's go ahead and talk about blood pressure. So you have hypertension, which is high blood pressure, and hypotension, which is low blood pressure. So let's talk about the numbers for a minute. The top number is your systolic number, and it measures the amount of pressure put on your heart while it's contracting. The diastolic or dystolic or bottom number is measuring how much pressure is on your heart while it's relaxing. So it would make sense that the top number would be higher because your heart's contracting, it's working, and that the bottom number would be lower because it's relaxing. So let's talk about high blood pressure. You know what, actually, let's talk about low blood pressure first, because low blood pressure isn't something you run into too much. Okay, let's see here. So I was talking about monitoring people with low blood pressure. And what we're monitoring for is dizziness, fainting, blacking out, fatigue, and these things are caused by the fact that not enough oxygen is getting to your entire system, especially your brain, because we all know that blood and oxygen love each other, and that's how we get oxygen into the deepest parts of our cells, into our muscles and everything like that. So pregnancy, you can experience hypotension or low blood pressure during pregnancy because your circulatory system is now working for two people. So that's common. Not good, but it's definitely something that we want to watch for. Dehydration. Oh my God, let's talk about dehydration. People do not drink enough fluid. It's just overall, people don't drink enough fluid. God, have a glass of water. And don't drink Gatorade. Oh my God, your body is not 70% Gatorade. Okay? I ask people that, well, how much water do you drink? Oh, I drink, 12 ounces. Well, how much coffee do you drink? Oh, I drink 32 ounces of coffee a day. Yeah, there's a bit of an imbalance there. If you have low blood pressure, your doctor may order IV fluids, may tell you to drink more water, because your blood is made up, your blood, liquid part of your blood is made up of quite a bit of water. So if you're having problems with low blood pressure, drinking water can help raise it. Blood loss, you can understand that. If you're bleeding out all of your blood pressure is going to be low. Seems to make sense. Do you mind, Scooter? Please? Oh, I'm so cranky. Okay. If you're old people tend to have lower blood pressure. It just makes sense. You know, things are slowing down. Do you mind? Okay, so that's enough there. Talk about that. If you have low blood pressure, the times when you want to see your doctor, or that I would recommend seeing your doctor if you've got problems, are dizziness, fainting, fatigue, lightheadedness, brownouts, you know, when you get like tunnel vision, or blackouts where you pass out totally. There is something called orthostatic hypotension, where, or you might call it a head rush, where if you stand up too quickly, from a sitting position or lying position, and you get dizzy, really dizzy, and you have to like hang on to something and wait for the blood to come back to your head rush. That's orthostatic hypotension. Some doctors will tell you if you have a problem with that, sit up slowly from a lying position, stand up slowly from a seated position. You got to wait for your body to get a chance to circulate everything to where it needs to go. Okay, so hypertension. This is a growing concern in America, especially because of the increasing obesity. So the amount of work that your heart has to do to get blood to flow through your system will depend on how healthy your heart is. If your heart's not strong, it's a muscle like anything else. If your heart is not strong, it's going to have a really hard time pushing blood through your system, and you're going to end up with a higher blood pressure rate. This can lead to all sorts of complications. The thing about hypertension is a lot of people don't have early symptoms. They may, but let's see, what are some of the symptoms? Headaches, dizziness, nosebleeds. That's it. A lot of people will walk around with high blood pressure, hypertension, and not even know it. So, let's see. Let me look over my notes here. Kidney problems. And I'm wearing my kidney shirt, my Hello Kidney shirt, which I love. Kidney problems. If your kidneys are not working properly, they're not going to be able to help control how much blood not only filters through them, how clean it is, but also how much blood is released from your red bone marrow. Your kidneys actually help control this, surprisingly enough. That's why kidney failure is such a problem. Not only because it filters out your kidneys, or your blood, but also because there are biochemicals that they help release. And they also control the amount of fluid that's in your body. We'll talk about the kidneys some other time because they're absolutely my favorite organ, totally incredible. Oh my God, so we'll talk about them. Adrenal glands, which sit on top of your kidneys, and they help control biochemicals that are released into your body to release red blood cells as well. So the kidneys and the adrenal glands coincide. They work together. Certain medications will raise your blood pressure, as well as uppers, drugs, cocaine, meth, things like that. So let's see here. Risk factors. Age is a definite risk factor. The older you get, the more sedentary you become. Do you mind not doing that right now? Here, thank you. I appreciate it. More common in men. The older men get, the greater chance you have of developing high blood pressure. Race, unfortunately, it is common. There are things that coincide with certain races. So it tends that African American men have higher blood pressure than other men of other races. Family history, of course, we're learning that now, that if you have a family history of a certain condition, that you're likely, your mom had it, your dad had it, you're likely to have it. So hypertension, high blood pressure, if your dad had it, definitely tell your doctor about it, because there's a good chance that you could have it too, especially if you're a man. Same thing with women. There are women out there with high blood pressure. I know we talked about being overweight, and there are actually a lot of things that go into that. So being overweight, lack of physical activity, smoking, too much salt in your diet, or not enough potassium in your diet, because sodium and potassium balance each other out. They're like two negative sides of a magnet. They don't want to be close to each other. So, let's see. So definitely, if you're not working out, you're not going for regular walks, you're eating too much junk food, and I'm not going to go into junk food because we all know what it is. You're smoking, definitely if you're smoking, that automatically raises your blood pressure. Drinking. These all seem to go together. People who are overweight, don't work out enough, have crappy diet, smoke, drink too much, these are all gonna send your blood pressure through the roof. And then of course stress. And it's just this horrible reciprocating cycle. So, and then certain chronic conditions like high cholesterol, kidney disease, things like that. So let's see what else. Okay, this is good. Complications. Of course, we all know that high blood pressure leads to heart disease, leads to heart attacks. And very common, if you have heart disease, you have high blood pressure. They go hand in hand. So a heart attack or a stroke, where your arteries harden and your heart just doesn't work the way it should be. It's like, okay, here's a science experiment for you. Take a rubber band, put it in the freezer, and then try and stretch it out. It's the same thing. Your blood vessels need to be able to expand and contract depending on your activity. And if they can't do that, they're elastic. And if the elastic's worn out because it's been stretched too much, it's not going to work anymore. Which ultimately can lead to an aneurysm. An aneurysm is when a little piece of crap that's built up in your vessel breaks loose and floats around your body. So, like if you're sucking through a straw and a piece of ice gets stuck in that straw, you're not getting anything through it. So that's, oh, I'm sorry, that's a thrombus. I'm an idiot. An aneurysm. So a thrombus is a bit of floating shit. An aneurysm is like a hernia. It's a bulge. And eventually it can break. And that's how you get, people die of aneurysms. A blood vessel in their brain breaks and they bleed out. So, the floating stuff is a thrombus. I apologize. I'm not perfect. Never said I was. And an aneurysm is a bulge in a vein because the vein has lost, or a blood vessel, I should say more appropriately, a blood vessel, because it's lost its ability to function properly. This is awesome. Okay, one of the ways that people can tell if they have early stage hypertension is in their eyes. Because the vessels in the eyes are so frail and so delicate, if you go and get an eye exam and the doctor notices that your blood vessels have ruptured inside of your eyeballs, it's a very good way to tell whether or not you have high blood pressure. And I've noticed now in my own eye exams that they'll take your blood pressure. It's one of the things they've started doing. Never used to do that. And that's a very early stage. It's a very good precursor. So, let's see, what else? Yeah, I think that's about it. There are some other convoluted things that I thought I wanted to go into, but I really don't. So, okay. WTFHealth@gmail.com if you have questions for me, have comments. Like I said, I'm not perfect. If you want to correct anything that I've said that might be wrong or you might know more about, please, by all means. I'm not a cardiologist. So yeah, that's it. So I don't know what we're going to talk about next time. Maybe kidneys. Let's talk about kidneys next time. We'll do that. We'll talk about kidneys next time. And I'll wear my Hello Kidney shirt again. Awesome. Okay, so that's it for now. Happy health. Bye-bye.